Hi everyone. My name is McLelan and I am in the undergraduate Health and Community Services program. I was lucky enough to be involved with the Remarkable Lives project. This project will create a much needed informational resource for the disability community. It will provide critical information for educators, health professionals, policymakers, and families. This resource will also involve community organizations as well as professionals and students from a variety of disciplines. My focus was on siblings of individuals with disability, or with Down syndrome, sorry. This is a personal interest of mine because my brother has Down syndrome. And there is little support in our community for, oh, sorry, I'm botching this hard. I focused on the support and resources currently available for siblings of individuals with Down syndrome. So, for my final paper and case study, I focused on the lack of resources for siblings of individuals with Down syndrome and disabilities. I looked at the lack of understanding and little support available in communities, and that siblings have needs that must be met. These needs include emotional support, programs, and meeting with other siblings in similar situations. This is because siblings may become primary caregivers in their future. So a reason why I thought this was really important is because a lot of the time, a huge focus right now is that parents are aging out, and with the improvement in the medical world and medicine, there is more responsibility placed on the shoulders of siblings. So the increased lifespan of individuals with Down syndrome has increased to above 50 years of age, with 1 in 10 individuals living to 7 years of age. This has been a significant increase from the early 1900s when the expected age was between 9 to 11 years of age. So, my role in this project was to perform qualitative and quantitative data analysis of online and community resources. I created a resource document that will be used on our online website once it's launched, as this project is just in the beginning. And finally, I used my networking skills from the Health and Community Services program to communicate with professionals and families in the disability community. The benefits of my practicum will allow siblings to better understand disability, create life care plans, and relate to others and hear stories from people in similar situations. By developing a better understanding of disability, siblings are able to have a clearer idea of their own future as well as their siblings. Lastly, by understanding disability and having resources readily available, siblings will be able to participate in creating life care plans for their sibling. These include financial, housing, and medical arrangements. This will also allow parents to be involved and create plans that will provide financial and emotional security for when they age and are no longer able to care for their child. So, overall, this project will promote inclusion of siblings of individuals with Down syndrome as well as individuals with disabilities, provide better support, reduce stereotypes, and create more community relationships. For myself, I have decided to continue on with my practicum as a volunteer and create a Canadian-wide survey for siblings of individuals with Down syndrome to better understand the needs of siblings in our community and country. So the last little bit, I would like to extend a huge thank you to Dr. Nigel Livingston for his support as my practicum supervisor. Also to Dr. Roy Brown for all of his guidance and information. And lastly to Betty Taylor and Lynn Davis, as well as the Health and Community Services grad class of 2015.
Thank you, Anna. Comments, questions? Asha and then Michael.
Thank you. That was excellent, and it is right. It's such an important issue, right? Because so many people are impacted when they become caregivers for family members. So I was just wondering if you can talk about some of the programs or things that are being planned a little bit more for siblings or for family members.
I'm actually not involved in any planning of programs, if I'm understanding your question. I was more looking at what's available currently. My hope would be that there would be more programs that would be available that promote inclusion for siblings of individuals with disabilities, as well as the individual with disability itself. For example, there's one on campus called Just for Kicks, and it can involve both siblings and the individual with disability. Other than that, also mental and physical support in communities is important.
Anna, thank you. As a parent of a child with a significant disability, this is a very important set of issues and really important in my life. I just wanted to thank you for a really interesting presentation. Thanks to you all. So let's hear it for Anna, please.